Hello doctor and medical students, I am Dr. Amit. So in our last video we discussed about classification of hemorrhage. Now today we'll move forward and today we'll discuss one of the most important concept in general surgery, that is pathophysiology of hemorrhage, in a very simple step in just a couple of minutes. So the first step is bleeding and hypovolemia. It means that first bleeding occur, that will lead to blood loss from the body, which will lead to hypovolemia, and there will be decreased circulating blood volume in the body. Now the second step will be decreased venous return and cardiac output. So it means that due to low blood volume in the body, venous return to the heart decreases, and that will lead to low cardiac output from our heart. Now the third step will be compensatory response by the body. So the body try to compensate this stage. How? So there is tachycardia and peripheral vasoconstrictions. It means that the blood is shunted away from our splanchnic vessels. It means the vessels supplying our abdominal organ by vasoconstrictions, so that the perfusion to our vital organs like brain, heart, kidney, lungs will be maintained. So this is our third step. Now the fourth step will be tissue hypoxia. It means that if the bleeding continue, oxygen delivered to tissue decreases, causing hypoxia. So it means that there will be low oxygen state in our body. Now the fifth step will be cardiac depression and worsening circulation. So various cardiac depressant substances are released, which reduces the pumping ability of the heart, and this further decreases the cardiac output and worsen the tissue perfusion. Now the sixth step will be anaerobic metabolism and metabolic acidosis. So as the tissue are not getting enough oxygen, so we all know it from our biochemistry concept that whenever there is low oxygen in any tissue, then that cells shift from aerobic metabolism to anaerobic metabolism, and due to anaerobic metabolism there will be productions of lactic acid, so there will be lactic acidosis, and finally it will lead to metabolic acidosis. Now the seventh step will be cell membrane dysfunction. So due to hypoxia and acidosis, the cell membrane function become altered. So due to this altered cell membrane, sodium and calcium moves inside the cells and potassium moves out the cells. So this will lead to cellular swelling and hyperkalemia in case of hemorrhage. Now the eighth step will be lysosomal enzyme release and cell damage. So the lysosomes inside the cells, it get ruptured and they release powerful enzymes which further damage the cells, and it finally destroy the cells. Now the ninth step in the hemorrhage will be coagulation cascade activations and DIC. So it means that there will be activation of platelets and coagulation cascade that will lead to formations of microthrombi in the circulations, and they may progress to DIC, that is disseminated intravascular coagulations, causing both thrombosis and further bleeding. So in some